Okay, welcome to our webinar on dental care for oncology patients, sponsored by the Young Survival Coalition tonight. My name is Anne-Marie Potter. I'm a legacy advocate for the Young Survival Coalition. I'm a 13-year cancer survivor, diagnosed at the age of 38. So like many of you, I had 3 small kids. Since being diagnosed, I've worked with YSC as a consumer grant reviewer for the Department of Defense Breast Cancer Research Program. I was a work group leader for the YSC Research Think Tank. I speak at local events, and I represented YSC as a consumer advocate at the San Antonio Breast Cancer Symposium. When I'm not doing advocacy, I'm a registered occupational therapist, and I'm the program director of the Master of Science Occupational Therapy program at American College. My research focus is on the impact of breast cancer on cognition and functional performance. I'd like to introduce my friend, Dr. Ronald Koslowski. He was born and raised in Los Angeles. He graduated from the UCLA School of Dentistry in 1991 and completed specialty training in Advanced Prosthodontics at UCLA and the Wadsworth VA Medical Center. He then was an American Cancer Society Fellow in Maxillofacial Prosthetics at Memorial Sloan-Kettering Cancer Center in New York City. In 2000, he became board certified in the specialty of prosthodontics and was named a Fellow of the American College of Prosthodontics. He lectures at UCLA School of Dentistry, and he has participated in the clinical training of dental students and specialty residents for over 15 years, and has a private practice specializing in prosthodontics. Here comes that big word again, maxillofacial prosthetics and dental oncology in Encino, California. So I've been on the YSC boards and noticed a lot of folks complaining, or not complaining, but talking about their dental problems. Dental care is often an afterthought of the oncology team, or if your oncology team's talking about it, it gets lost in all the information they're giving you during diagnosis and your initial phases of treatment. Although it's known that cancer treatments may have a detrimental effect on oral health, the management of oral health is not a prominent component of patient education. Just preparing for this webinar, I did a little research, Googling, and where many of us go to for cancer-related information, and the National Comprehensive Cancer Network acknowledges that this is a missing component of dental education, with them citing the website for the National Institute of Dental and Craniofacial Research, that most people are aware of common side effects of cancer treatment, such as nausea and hair loss, but many may not realize that more than 1/3 of people treated for cancer develop complications that affect the mouth. These problems may interfere with cancer treatment and diminish the patient's quality of life. So I imagine that's why many of you have joined us this evening for this webinar. I'd like to let you know that you can submit questions through the chat function. As many things with being involved with survivors, please request that we request that your questions are in a general format and not specific to your own care or situation, so they're more applicable to everyone. If you are bothered by your screen switching back and forth between the 2 speakers, if you click on gallery view, that will show both of us speaking, and it won't switch back and forth. So let's get started. First, I'm going to have Dr. Koslowski start with an overview of what happens to our mouth and teeth as a result of chemotherapy and the best way to care for teeth during chemo.
Thanks, Anne-Marie. Great to be here, and thank you again for asking me to participate in this webinar. This is a very important topic, and as you had mentioned, it's one of the things, dental care before, during, and after cancer treatment is often a very overlooked topic, and I'm happy to help in presenting some useful information, hopefully. So with breast cancer, the oral complications, yeah, typically do come from chemotherapy. Radiation therapy, maybe a little bit more so in cancers of the head and neck. Folks to start off focusing more on chemotherapy. Well, as you know, the chemotherapeutic drugs are toxins, and they cause cell death. And the operating principle is that cancer cells divide much more rapidly than normal cells, and the chemotherapy is targeted to kill the cells as they divide. Unfortunately, a lot of the chemotherapy is kind of a blunt instrument, and does a lot of damage, as you know, to normal cells as well. Most commonly, what we would tend to see intraorally, a significant number of people could have bleeding, mucositis, so basically, inflammation of the soft tissues of the mouth. As blood counts drop, and platelets drop as well, the turnover and ability to heal in the mouth is affected. So people can basically, when it comes down to it, just end up with sores in their mouth, and also with spontaneous bleeding, especially if blood counts are low. Other things that can happen is if there are any dental infections. A lot of dental infections, people are walking around with a lot of infection that's subclinical, like no symptoms, and if these things aren't caught before cancer therapy starts, then things that can happen are things like fevers of unknown origin, and things that can interfere with cancer care. Can actually, a fever of unknown origin can often lead to interruption in treatment. So these are all things that are better prevented than dealt with in the middle of treatment.
So what are your recommendations for dental care while you're in treatment?
While in treatment, really, we would prefer that the dental care be done ahead of time. So really, it's more of a emergency only. So my emphasis is always to get dental conditions under control before the cancer treatment starts. So if I'm seeing a patient who's in the middle of their cancer care, and I see them on the schedule and they're not done with their treatment, then I know something is amiss, and those are the situations that I would prefer to have prevented.
So we received a question before the webinar. During treatment, should we start brushing our teeth more frequently? What can we do at home to improve our oral hygiene? Oral hygiene, best thing to do, start improving the dental hygiene before the treatment starts. So in the middle of treatment is probably not a time where you want to start learning new techniques and different kinds of flossing or brushing, because then you might floss a little too aggressively, or brush a little too aggressively, and things like even scraping the gum tissue with the hard part of the toothbrush is something you have to watch out for. I've seen oncologists tell their patients to not brush their teeth, which I think is a bad idea. What they really mean is to be extremely careful. Use extra soft toothbrushes, and just be gentle. Ideally, go for hygiene visit before starting the treatment. Talk to the doctor, talk to the hygienist about best ways to gently keep their teeth clean. So the best time to get teeth cleaned is between diagnosis and the start of treatment.
Correct. Yeah, so that's essential. And unfortunately, it's one of the things that often falls by the wayside, or maybe just gets lost in the mountain of information that that a recently diagnosed person would be receiving. And oncologists may mention in passing, go get your teeth clean, get them checked. But really, based on my experience and training, it needs to be emphasized more.
Certainly. So we just got a question in under the chat. So if somebody prior to chemotherapy has receding gums or gingivitis, are there any routines or products that can help with the bleeding gums? Any recommended things to help fight infection?
Okay. So the bleeding gums is definitely it could be a sign of many things. It could be in the best case, it could be just what we call gingivitis, which means that the bones supporting the teeth is still in good shape, but maybe a little more careful brushing and flossing is necessary just to get that under control. As far as products, rinses, like Listerine is a pretty good product. Really all any of the over-the-counter rinses can be helpful. No, there's no substitute for the careful brushing and flossing. There are some newer products out, like Waterpik has a product that they call a water flosser, which can be useful. Still have to be careful with things like that. Use them on a low setting because we don't want to traumatize any tissues. And when there's treatment, chemotherapy in progress. So really a matter of keeping great oral hygiene. If it's just before starting the treatment, and there hasn't been any dental care in a while, then there may not be a whole lot that can be done in a hurry. If there are issues with loss of bone that's supporting the teeth, and that's called gum disease or periodontal disease, then those kinds of conditions require long-term management. And when there's treatment pending, it's just a matter of doing the best we can to get the plaque and tartar off the teeth ahead of time.
So we've gotten several, actually questions are coming in here, several regarding for the women who are living with metastatic breast cancer who never are out of treatment. Where do we go with that?
That can be a tough one. One of the possible places that breast cancer can metastasize is to the jaw, and that is a very difficult situation to deal with, because then we have direct oral complications. Maybe receiving radiation, possibly to the head and neck, to control that. And when radiation is given to the head and neck area, then we have a whole new set of problems. So those can include dryness of the mouth, because when cancer spreads to the jaws or originates there, the dosage of radiation can go right through where salivary glands are. So even though radiation fields are tailored very carefully in 3 dimensions these days, they can really limit the field to exactly where the radiation needs to go. But really there are some major salivary glands in the way. So then the mouth can get dry. And when that happens, we can get some very rapid tooth decay. So those are all things that needs to be addressed ahead of time. And when someone gets into the realm of radiation to the head and neck, the radiation oncologists are really up on this stuff, and they know that they need a dentist who has proper training on their team to help prevent complications. Ideally, when we have to manage complications like bad advanced tooth decay, that becomes a really difficult task to deal with. And we don't ever want anyone who's received a lot of radiation to the head and neck to have to undergo any kind of oral surgery, like having teeth taken out, because that can lead to other problems like osteonecrosis, basically bone not healing properly, which can be a dangerous situation.
So as far as the women who have metastatic cancer, can they stay on a regular cleaning schedule with their dentist?
Yeah, extremely important. And we, I've only mentioned the metastasis to the jaws, but there are other metastases as well, which would probably require maybe more intense chemotherapy than radiation possibly. But yeah, regular visits to the dentist, again, before treatment starts, to control as many potential infections as possible. If there are any teeth that are in bad trouble that potentially need to come out, that needs to be taken care of before the cancer treatment starts. Also, if any root canal treatment's needed, which root canal treatment is a very safe treatment that's done when there's decay that affects a tooth nerve. But the research has shown that that is actually a very safe treatment, even if someone's had cancer treatment in the past. The essential thing is checking. The dentist should be checking in with the oncologist, looking at most recent blood counts, making sure that everything is in a safe range, even for a cleaning, because something as simple as it seems like it would be dental cleaning would be the simplest thing you can imagine, but it is something that can actually introduce bacteria into the bloodstream, cause bleeding. So those are all things. So basically the dentist needs to become a member of the medical team and interact with the cancer docs.
Great. So I'm just going to do a quick reintroduction here. I'm Anne-Marie Potter. I'm with the Young Survival Coalition as a legacy advocate. And tonight we're talking with Dr. Ronald Koslowski, a prosthodontist and specialist in oncology dentistry. So please submit questions through the Q&A function. We're seeing them come up and we've already started answering some. So some women are put on fluoride treatments during radiation or chemo. How long should they be continued? Is that common?
It's not as common as it should be. So patients who are undergoing treatment for head and neck cancers, then yeah, absolutely. That's pretty well established. But for patients with breast or other cancers who that are not in the head and neck area, it seems like the mouth has no connection there. But dry mouth can be a side effect. In fact, dry mouth's a side effect of literally hundreds of different medications, beyond even cancer medications. So fluoride is an essential tool that we use. Often we'll make special carrier trays. There's almost, if any of you have ever bleached your teeth, you have special trays that you put the bleaching material in. So little trays like that can be used to apply fluoride to the teeth every day. And it just becomes part of the daily routine. There's one of my favorite ones are the Prevident made by Colgate, which is a prescription strength fluoride. That's kind of what it looks like, and they actually make one of their formulations is a dry mouth formula. So if someone is getting soreness in their mouth as a result of their treatment, you can still use that dry mouth formula. Very little irritation from it, and when it's applied with special custom trays, it adds a tremendous amount of protection to the teeth. It won't fix cavities that already exist, but it can prevent new ones from forming. And I recommend that it become a permanent part of the daily routine.
So one big concern of both survivors and people living with metastatic disease is Zometa, the bisphosphonates, Xgeva, Densumab. These all have osteojaw necrosis as a side effect or warning on them.
Yes.
And yeah, that's a big concern. So how best to, is there anything first that you can talk about regarding, is there a way to prevent this from happening?
Okay. Yes, and it's kind of and it's really an ironic thing that these medications were developed to protect the bone, and they do a great job of that, except in the jaws, and in the for whatever reason, and the there's been some theories, but some of it has to do with the blood supply to the jaw being more limited, uh, but really what can happen is it can have an opposite effect on the jawbones. The side effect called osteonecrosis is something that we used to pretty much just see with patients who've had high doses of radiation to the jaws. And in that situation, the jaw won't heal properly after having a tooth pulled or after having some kind of gum surgery, and what we found in recent years is that this can happen with the bisphosphonate medications as well. More so with the ones that are delivered IV, like Zometa. What can happen in those cases is a really dangerous situation where the bone becomes exposed, and it just won't heal. So basically, you just have exposed dead bone, and patients have lost pieces of their jawbone because of that. So yes, prevention is key, and that's really the only way to deal with it properly. Because once we start seeing exposed bone, then it becomes a management, ongoing management. So it starts with the dental visit before the treatment starts. And as someone who, preferably a dentist who has some training in what to look for, and making sure that there are no teeth that are in bad shape to the point where they would have to come out. But if that is the case, then getting that taken care of and allowing some healing time before starting this kind of medication. The oncologists are actually pretty well versed in this at this point, because they may have seen some of these complications occurring. So looking for, thorough cleaning ahead of time, looking for any teeth that need any kind of surgical treatment or any gums that need any kind of surgical treatment, getting all of that done. Even if there's a lot of cavities that need to be fixed, taking care of that as quickly as possible before starting the medication is the best way to prevent that.
So what are some of the warning signs that people should look for if they're on Zometa or Xgeva?
So they want to look for any areas where they're feeling roughness inside their mouth, where anything that feels different, that feels like it shouldn't be there, any kind of pain that won't go away, and getting into the dentist as quickly as possible to evaluate that.
And so what is the treatment if you end up having osteonecrosis?
Very careful management. So starting, and there's a whole classification system that the oral surgeons. So oral surgery isn't my specialty, but I work closely with oral surgeons, and they've developed kind of a staging and grading system for osteonecrosis. So a grade 0 through 4, I believe it is, and it's based on how much bone is exposed, measured in millimeters, and how long it's been exposed. So small areas are really just managed. They could start off managing just with antimicrobial rinses, like something like chlorhexidine, or Paradex is the trade name of that. So rinsing with that, but really you don't want to try to manage this yourself. You want to get into dentist as quickly as possible. Most dentists will probably, if they see exposed bone, will probably refer to the oral surgeon right away. Really it's something that's beyond something that's managed just with rinses. If the exposed bone area is increasing in size, if it's progressing and not getting better, then just very careful cleaning by the surgeon, just kind of just debridement of any exposed bone, careful monitoring. And those are the things that just need to be done as quickly as possible.
So thanks for that nice rundown, because that is a huge concern, and so many women are on Zometa.
Yeah, and it's even a concern with some people who just have osteoporosis, and they're being given oral medications like Fosamax. We still have to be careful. The incidence with the oral medications much lower, but the risk increases over time. So taking these oral meds over the course of years can also present that kind of risk.
So we've had quite a few questions, and this is really what prompted, I answered a post on our Facebook group. Teeth, it's typically described as teeth just crumbling, years or so outside of breast cancer treatment. What's kind of going on with that? Can it be prevented?
So it depends on what is causing the crumbling of the teeth. I'm assuming maybe tooth decay. So if it's tooth decay, it's usually related, and after breast cancer treatment, usually associated with dry mouth. So again, preventing that from happening, daily fluoride application, cleanings, and the kind of the standard in dental care is to get your teeth cleaned and checked twice a year. But really, as a cancer survivor, much more careful monitoring. So every 3 months is what I typically recommend. And and if someone is having some severe complications, maybe even every 2 months. So we tailor the follow-up and the treatment for each individual person. So if there's already a lot of decay, so if the teeth are crumbling because of tooth decay, then and there hasn't been and the blood counts are good, treatment is finished, and there hasn't been any high dose of radiation to the jawbone, then really proceeding with restorative dentistry. If they've had the bisphosphonate medications, then working closely with the oncologist and with an oral surgeon to make sure it's safe to remove any teeth that can't be fixed. And then other reasons teeth could crumble, possibly tooth wear from grinding. The dental term for that is bruxism, but really it just means clenching and grinding of the teeth. That wouldn't necessarily be a direct result of cancer treatment, but I can imagine with the amount of stress that cancer patients go through, clenching, grinding of the teeth may be one of the coping skills. So again, just regular follow-up, preventing tooth wear from things like clenching, grinding. We can make special mouth guards that are customized to help protect the teeth. So those are what come to mind immediately when I hear about crumbling teeth.
So some of the issues, like you went ahead, so we did have a question about the teeth grinding. What about the over-the-counter things you can get for teeth grinding?
Better than nothing, but not much better. Yeah, you'll find them in all your drugstores, some over-the-counter mouth guards. I would only recommend, well, if you're in the middle of cancer treatment and you're at risk for oral bleeding, absolutely not, because those over-the-counter trays can have some sharp edges, can scrape the gums, things like that. If it's a matter of just an emergency appliance to get you through until you can get into the dentist, and everything else is all right, then sure. But long-term use can cause changes in the bite and maybe even damage to the gums and teeth. So very important to work with a dentist who can make a custom appliance for you.
Well, I'm glad you brought that up because that's good advice to our listeners. So there have been some questions about crowns versus implants. Any recommendation? And when we've have this tooth decay and teeth need to be repaired after cancer treatments?
Yes. So when there's decay to the point where a filling won't fix a tooth, and the tooth itself is weak, so we can make crowns. So basically, that's something that encircles a tooth. It's a custom shaped piece of ceramic, usually. That will be cemented or bonded to what's left of the tooth, and those can be very protective and helpful. When a tooth is so badly broken down that there isn't anything for a crown to predictably grab onto, then yes, losing a tooth, replacing it with an implant, which is basically just an artificial tooth root, is a great treatment. Again, not a kind of treatment that can be done during cancer treatment. And if it's done after cancer treatment, the doctor does, the oncology doctor and the dentist need to consult and make sure that any kind of risk is mitigated.
Great. So we do have some questions coming in, but I also want to remind folks to please go ahead and keep sending us questions. So insurance, quite a few questions.
I have to go now. That's my least favorite topic.
Yeah, so I guess on your side, insurance isn't a great thing to deal with either. So there are a lot of questions regarding would dental issues as a result of cancer treatments, would they be covered by health insurance versus dental insurance?
Unfortunately, I've had, because of my specialty, I've had the displeasure of working with health insurance carriers, and unfortunately, they consider dental problems to be outside of their purview. Now, the exception is, and it's an interesting exception, is prior to cancer treatment, if the patient is referred to the dentist, then yes, consultations, x-rays, and sometimes even removal of bad teeth can be covered as the treatment is a necessary part of the cancer care. And what happens, and I have no idea why this is, but after the fact and after the cancer treatment is complete, necessary dental treatment is rarely, if ever, covered by health insurance. So dental insurance can be helpful. Dental insurance, in relation to health insurance, dental insurance is not insurance at all, though. They're really just defined benefit plans that give a certain amount towards treatment. So if somebody needs, if somebody needs a couple of fillings, if they need their teeth cleaned, if they need maybe a crown, then yes, dental insurance can be very helpful with something like that. And unfortunately, if there are catastrophic problems like teeth, like multiple teeth crumbling as we talked about before, then the dental insurances really aren't designed to cover major things like that.
So what do people do in these situations? Because, I mean, you're already like, we've already got a lot of medical bills, but we need to be able to have good oral health to be able to even eat and speak and do everyday things. You know, what do we do?
Well, so I would suggest, you know, working with your dentist on you know, ways that will, you know, treatment plans that will fit within a budget, you know, maximizing the insurance benefits if there are any. I would not recommend someone to go out and buy dental insurance on their own because it really, it doesn't do much in those situations if you're paying for it yourself. If you have an employer that's provided you with dental insurance, then great. But I would make sure that you can that you don't have to choose from a list, and you definitely want to go with someone who has experience working with cancer patients. So you know, most dental practices will have you know, financial arrangements that can be made to help you know, make things as affordable as possible. Other options are the dental schools. If you live in a town that has a dental school, that becomes a time versus money question, because treatment at the schools can be very thorough, but also can take a lot longer. And you know, and the trade-off is that the fees are usually much lower. So that's often, I consider that to be a, you know, a last resort if treatment in private practice is not financially manageable.
So would there be specialists at these dental schools to, or, you know, like, do these students know about cancer?
Well, well, I would recommend working with on the graduate level. So yeah, so the dental students are, you know, yes, they are supervised by licensed dentists, but even those licensed dentists may not be very well versed in oral complications of cancer treatment. So so if you're going to one of the dental schools, you would want to work on the graduate level with people who are already dentists who are studying to become specialists. And that's, you know, for many years I worked at UCLA, you know, helping in the training of residents in prosthodontics, and these are guys who are just, you know, really top-notch people. And you know, so so you can save a lot in costs that way, but the trade-off is much greater time commitment.
So, and I can attest to the time commitment, because when I was in grad school, I did go to the dental school for my dental work, and the cleaning did take quite a bit longer than a private dentist, but they did a good job.
Yep.
So you had mentioned more frequent cleanings. When this happens, our typical dental plans cover 2 cleanings a year. Would they be covered by our medical at that point, or would the dental insurance pick up extras?
Typically not, but it depends on the plan. So what you'd want to do is, you know, basically look at the explanations of benefits that are provided with the plan. And those are usually the things that you kind of throw away when you know, get it in the mail. And so and usually the dentist's office, if the dentist is participating in the plan, whoever does their insurance billing would probably be able to research that and find out. You know, the best plans are the plans that actually, you know, these are from the really nice employers who really want to invest in their employees. They'll provide what they call a direct reimbursement plan, where they'll say, you know, go get whatever you need, and and bring us the bills, and we'll take care of them. Those plans, unfortunately, are not very common. But those are the kinds of plans where cleaning every 3 months would be covered, because they're giving you basically an allowance for your treatment to use however is necessary. So if they're the kinds of plans where you have to choose a doctor from a list, chances are you may not get any extra coverage.
So that was kind of one of my questions, was how do you advocate for insurance reimbursement? Typically that benefits coordinator at the dentist office would maybe
Yeah.
help?
Yeah, so they can give you the most help, and when it comes down to it, it's part of their daily frustration of trying to get the reimbursements because the insurance companies, unfortunately, are not in the business of paying out anything that's asked for. They're in the business of rationing care, as you probably well know.
Yeah, yeah. So I just saw another question come up here. So for individuals on Zometa Infusions, which I'm not sure if they're monthly or bi-monthly, but if they need to have fillings, because they'll be on these Zometas for years,
Right.
some of us, not me, but I know quite a few women.
Mm-hmm.
If they need dental care, should they delay their Zometa infusion?
Depends on the kind of dental care. So if this is ongoing and they need it, once a month, once every couple of months, then it's really a matter of prevention. So if they're going to the dentist, one of the common things you hear in dentistry is, well, let's, that looks like it could become a problem. Let's just keep an eye on it. Or it looks like a little cavity. Let's keep an eye on it. And no, so that kind of thinking, it doesn't work in these situations. So if there's what looks like a small problem, needs to be taken care of right away before it becomes a big one, because ongoing treatment with bisphosphonates, stuff like Zometa, then you can't ever be in a situation where you have to have oral surgery, like have a tooth pulled or have to have gum surgery. So yeah, taking care of problems when they're small before they become big is the key.
Great. So please send in any questions. I have one more question, but definitely if there are any more questions from the audience, please send them in through the Q&A. What do we look for in a dentist after treatment to figure out if he or she is qualified to handle post-chemo radiation issues?
Well, ideally, you would want to look for a dentist who's had additional training in this, and the best people are ones who've gone through training at a major cancer center. There are some general dentists. So when I did my training at Memorial Sloan-Kettering, we had so I had a co-resident who had already done prosthodontic training like me, and we're taking the extra year to work with head and neck cancer patients. But we also had two general dentists on our team who were just fresh out of dental school, and they decided to spend a year at Memorial in order to really take great care of cancer patients. So generally not something that would be obviously seen. So if you seek out a prosthodontist who has training in maxillofacial, you can find someone in your area. Our national organization, American College of Prosthodontics, has a search tool at gotoapro.org. And you can search by zip code, and you would want to find someone who has training in maxillofacial prosthetics. I know it's a mouthful, but that is our subspecialty. And if it's a general dentist you're seeing, you would probably want to ask if they've had any training or at least a fair amount of experience in working with cancer patients.
So our one of our audiences, well, actually, let's do this one first. What was the website again?
Can you okay. Go to a pro.org, O-R-G. So GOTOAPRO. Is that right? Go to a pro. .org. Yes, my spelling is okay.
We must be wearing you down here with all
it's Friday afternoon. No, and that's not my website. That's the national organization for the American College of Prosthodontics. So that would be a good starting point.
So one of our participants said, did you recommend to delay future infusions if there's a dental issue with Zometa? She says, I understand not to let small problems get worse.
Yeah. So if it's a matter of just taking care of fillings, or if you need a crown, something like that, even if you need root canal treatment, those are all safe things. You still want to have your dentist consult with your oncologist, and make sure that it's you're in a safe spot as far as your blood counts, things like that. But if there's anything beyond that, if there's a tooth that's infected, and the dentist said, well, this tooth needs to come out, or if you have a gum infection and they say you're going to need some kind of gum surgery, that's when the dentist and oncologist need to have a conversation and say, okay, well, is it safe to go off Zometa for a while? One of the things about Zometa is it doesn't clear generally. I mean, we don't even know how long it takes to clear completely. So it may just be a matter of if there's a real emergency and there has to be a tooth taken out, then it's just a matter of very careful management, doing the procedure with as little trauma as possible to the bone, and then careful follow-up. Hopefully it's just prevention is the way to manage that, and hopefully no interruption in your cancer treatment would be necessary.
Well, I do not see any other new questions coming up. Any parting words of advice?
Parting words of advice: take care of yourself. Ask questions of your doctors. Don't assume that you've been given all the information you need. And if you're facing a cancer diagnosis, and you're going to be, I'm sure it's overwhelming, all the information you're receiving and all the appointments you're going to and all the tests being run. Just don't let taking care of your smile fall by the wayside. And that's part of my mission is to make sure that that information is out there. That's why I wrote a book on the topic, Take Back the Smile that Cancer Stole. And that's something that was a project that was very important to me. And that's pretty much everything.
Thank you so much, Dr. Koslowski, for joining us, supporting Young Survival Coalition. Thank you to the audience for checking in tonight. Thank you probably for our future. Actually, we just got one more question. Joined late. Did you say fluoride in toothpaste can prevent tooth decay?
Wait, say that again?
Does fluoride in toothpaste prevent tooth decay?
Yes, absolutely. That's why it's there. And that's one of the most well-researched things around as far as prevention of tooth decay.
Great. So, and thank you to our audience for participating tonight. I hope everyone found it helpful, and the webinar will be posted on YouTube in a week or so if you missed anything. So thanks a lot.
Thanks, Emery. It was a pleasure.